and Kennedy Green. Communication between nurses and patients is essential to reach the needs of the patients. In order for nurses to reach the full potential of all of their interventions involving patients, communication must be utilized correctly. In the field of nursing, the communication aspect is more than just getting a point across. It assists in the process of healing. The nurses must listen and take in the information given to them, while patients must also listen and take in the information given to them by the nurses. In order for the nurses to be successful, they must focus on information between themselves and the patients. Communication not only helps get the job done, but effective communication also makes the job easier. If the patient does not feel comfortable with the nurse, their relationship will not go smoothly. One of the most important concepts of communication between nurses and patients is the ability for patients to feel comfortable and undistracted. The patients and nurses must be focused to ensure information being passed on is adequate and understandable. Noisy environments and multitasking hinder proper communication, according to page 86 of our textbook. On page 86, it also states that it's vital not to get hung up on unimportant details. Quite often, patients will respond to communication from nurses with anger, disbelief, or denial. This makes for difficult communication between the two. In order for nurses to know what their patients are feeling, it's important for them to understand cultural beliefs and rules. According to our textbook on page 153, it's also important for them to understand different physical attributes of emotions, including sweaty hands, playing with hair, touching their face often. Nurses use listening in order to provide their patients with proper care. They must listen for symptoms, concerns, and about personal aspects to get the entire story. In our textbook on page 80, it discusses the 5 stages of listening: receiving, understanding, evaluating, and responding to verbal and nonverbal messages are extremely important in the communication between nurses and patients. I learned many things, and the most important thing being that communication is absolutely vital between nurses and patients. Communication is the only way to ensure patients receive the care they're looking for.